Live in Nashville, your Godzilla of the Truth right here. Joining me now is Professor Dr. Carol Swain. She was a professor of political science and law at Vanderbilt University. I used to live right by there back in the day. And she's also now a political activist. She's the author of several best-selling books, and she's with us now. Dr. Swain, great to have you.
Good morning. Welcome back to Nashville.
I know, right? I used to live right by Vanderbilt when I first got married, very long time ago. We had season tickets to the Commodores basketball games, and I love going to that, and I had really good seats also. I love the fact that they play like I know people have seen it on TV, but basketball court is actually down. It's in a pit. When I used to go there, they were very tough at home. We sold out every game, and back in the day, not so much, but great to have you with us.
Thank you.
All right, so let me just ask you this. So in Ventura County, Dr. Swain, in California, and a long time back I worked at the Ventura County Star. So in Ventura County, they're doing a test program. They just launched this yesterday. And here's what it is. They've hired 100 people in Ventura County, so there's 100 government jobs, and these are contact tracing professionals. And what their job is, if somebody tests positive for COVID-19 in Ventura County, then you have to tell the government official who you've been in contact with for the past 10 days. And so let's say it's 10 people or 15 or 20, whatever the number is. Then the contact tracing auditors go out and they find these people and they tell them that they have to quarantine for 14 days. They can't go to work. They can't go to their house. They have to stay in their house. And they come and visit them every day in their homes or apartments or condo, wherever they live. They visit them every day to be sure that they're home. And if they're not, they get a fine. And the second time, they get hauled off to jail. Like a parole officer, that would bang on the door and you'd have to pee in the bottle. And if you come up positive, they haul you away back to jail. I'm not making this up, Dr. Swain. This is a real program that starts on Monday. What is going on in this country?
I agree with Dennis Prager and others who have said it is a dress rehearsal for martial law. And, years ago I read the book 1984, and I've read it more recently. And it seems like we are experiencing the beginnings of totalitarianism. And my dismay is that not enough people have pushed back.
Why? Why haven't people pushed back?
Why have they not pushed back?
Yes.
Because they're so trusting. And right now, the government has made it very comfortable for people to be in their homes. So for government workers and others that have financial means, this is a European vacation.
What about
a lot of Americans haven't had vacations before, so we have paid vacations for some people.
For 12 weeks, right? Because the unemployment runs out in July. I've got a lot of people, business owners, that can't get people back to work. Even if they do open, they can't get them back to work because they're making, like in Maryland, you get $1,000 a week on unemployment. So you're making $25 an hour. Why would you come back to work at a restaurant for $6 an hour plus tips when you're making $25 an hour to stay home?
Why would the COVID-19 coronavirus numbers go down when you have incentivized health workers to inflate the numbers? And so if hospitals and clinics have a monetary reason to inflate the number of COVID patients, then why would the numbers ever go down?
Well, each hospital in the United States, Dr. Swain, gets $13,000 for every COVID patient that they treat. So if I go in with a broken ankle, and they got to patch my ankle up, and I cough, they put that as COVID-15, bang, they get $13,000. If I go on a ventilator, they get $39,000. So I sneeze, they put me on a ventilator, they get $39,000. They code me as COVID-19, even though it's a maybe because I sneezed, they get $13,000. And if they die...
Which is more likely to happen on the ventilator.
I mean, guess, Dr. Swain, what I'm perplexed at is, where's the outrage? Where's the pushback? Where's the the people upset over the complete erosion of their freedoms and civil liberties? Where is it?
I guess Americans have just grown so complacent, and I have a great concern about people in nursing homes not being allowed to see their loved ones and their patient advocates. I worked in nursing homes for years, and I know that under the best conditions, those patients get horrible care. And even in places where you would think they would be getting great care, they have traditionally gotten poor care. And I think that now that they're not being monitored, there's no telling what's happening behind the walls.
I hadn't thought about that, Dr. Swain, and you're right, because nursing homes notoriously have not only poor care, you have abuse. That's why there's patient advocates for the elderly. That's why, and also you think of the depression of not being able to see anybody in your family. You're just stuck there, basically in permanent quarantine. So that's an issue. We're with Dr. Carol Swain. She's a former professor at Vanderbilt University of Political Science and Law. You often see her on TV. She's also a noted author, and she knows a little about coming back. She was a high school dropout and a teenage mom, and then ended up being a very highly accomplished university professor. So, Dr. Swain, let me tell you something my wife said a month ago. I've been with her a long time, and it's really resonated. I didn't get it at the beginning, but now I do. When all this was going down and people were being stripped of their liberties and everybody just stood in line like sheep and did whatever the politicians said, my wife said, you know what? Here's what the COVID-19 is doing. It's exposing Americans. It's exposing America, because the outside world looks at us and they think of Americans as these freedom-loving, rugged individualism that will fight for their liberty, and they'll stand up to anything, and they demand to hold their politicians accountable, and it's not Europe and it's not Asia, and that's the American way, these tough, rugged, individualistic people. And then we have the COVID-19, and we're exposed, because that's not the America that was. The new America is feed me, government, keep me safe, tell me what to do, tell me what box to stand on, tell me what time I can go out, tell me how many times I can walk my dog. If somebody walks his dog too many times, I call the 1-800-RAT line, and that's fine, as long as you direct deposit money into my bank account. Oh, by the way, I can still get drunk and smoke weed all day. And here's the other thing. If I get COVID-19 now in Ventura County and I come in contact with someone, then that person is treated like a criminal. They are checked every day to be sure they're home. And if they're not home, they get a fine. And the second time, they get cuffs. And they've done nothing other than go out. This is your new America, Carol.
Well, I can tell you that the Ventura County policy will result in a lot of people ratting out enemies or people that they dislike. There's no reason why they wouldn't. Some people give names of individuals that they just don't like for some reason.
I mean, look, if I get COVID,
form of harassment.
Sure. If I get COVID-19 and I'm in Ventura County and I have a neighbor that can't stand the guy or gal, I can say, yeah, I shook hands with him. And then they go in there and maybe that guy's a house painter and they're like, sorry, you can't paint. You have to stay home or you will get a fine. If I check on you and you're not home tomorrow and I'm not going to tell you what time I'm coming, you'll get a fine. And if it's the second time, we will hunt you down, call the police, and you'll go to jail. That's what they're doing, Carol, in Ventura County. And nobody says a word. It's like, oh, okay, well, it's going to keep us safe.
Well, the good that could come out of this is that maybe, just maybe, some of the people who have trusted the Democrats, because in cities and states that are governed by Democrats, it tends to be more oppressive. There are a few exceptions, with the governor of Maryland, and at one time the governor of Tennessee was leaning in that direction of being overly authoritarian, but he has come back to his senses. So I think that it may very well be a boom for the Republican Party, except there are a lot of Republicans that are going along with what the government has to say. And there was a book some years ago, How to Kill 11 Million People, and the answer was to lie to them. And I think with this COVID-19 coronavirus that there are plenty of scientists and plenty of people who have financial and political motivations that align to us, and the rest of us are falling into lockstep with their plan and their agenda. So it is a plandemic rather than a pandemic.
You said earlier that you thought this was a dress rehearsal for martial law. Can you elaborate on that, Dr. Swain?
I'm just, because we have allowed so many of our rights and liberties under the Constitution to be trampled in the name of keeping us safe. And there's all this social pressure. I don't know if you wore a mask last night, but here in Nashville, we expected to wear a mask if we go outside our homes. And as you know, the masks are very uncomfortable, and there's a lot of research that suggests it may be adverse to our health to wear the mask, and that doctors and nurses, that people that wear them long term, they get headaches, there are health consequences. So that's one of the things, and we are weakening our immune system so that we will be more likely to catch coronavirus or any other viruses and diseases out there once we come out of our homes, and once we, even with the mask on, we're more likely to catch these things.
You're exactly right, Dr. Swain. There's evidence now that's suggesting staying home, wearing a mask, wearing gloves breaks your immune system down and increases your likelihood to get this virus. This is how stupid this is. Because,
well, let me tell
look,
you
this,
it's not stupid for the left. It's not stupid for people that believe in population control and global warming, because they really would like to reduce the population. And so it works. It will work like a charm for them because they're trying to get rid of people, not save lives.
Right, so the whole thing is a scam.
I feel like it is, and I was always suspicious, and I have, from day one, things just didn't add up. All the steps that we were taking, given the number of deaths, when you look at those in relationship to the population of the U.S., the population of the world, the deaths have been minuscule. Even today, when you talk about 70-some thousand people have died from coronavirus, we know those numbers are inflated. They're not real. But if you take those numbers in relationship to other causes of death and the fact that our country has about 330 million people, you can see that this was an overreaction from the very beginning. And I believe the president got bad advice from people who had political agendas as well as financial interest in getting us all vaccinated. And we know that Bill Gates, George Soros, Warren Buffett, and a lot of people like that, the globalists, are behind this.
Do you think Dr. Fauci's a fraud?
He's not a fraud. He's someone that is a mouthpiece for Bill Gates. Bill Gates, the Bill and Melinda Gates Foundation, gave his program $100 million last fall. And, I mean, you can look that up. And they are also huge donors to the CDC, to the NIH, and just about every organization that can decisions about how we are treating this virus. And so the research organizations, the one at Johns Hopkins, the one at the University of Washington, the World Health Organization, if you map out where he's given his money, I think very much the decision makers, the ones that are telling us how to deal with this pandemic, are people that are pretty much, I believe, influenced by the private and donations they receive from foundations and individuals and corporations that have an interest in the drugs and the medical supplies.
They're the ones also that are holding the patents, right? And one of the
yes,
reasons
I mean,
that,
right.
I got to go, but one of the reasons they didn't want the malaria drug to succeed was because they didn't hold a patent on it, and it's very cheap, so nobody could make money off it. I mean, we're not stupid, Dr. Swain. We just have to have the courage, like you are today, to now fight back. Because when you look at what they're doing in Ventura County, I mean, that should send a chill up everybody's spine. You can get arrested for not staying home because somebody said they contacted you who has the virus. It's unbelievable. It's like now we're going to be arrested and the criminals are getting let out of jails. It's like you're living in that book, Dr. Swain, 1984. Thank you so much.